So a lot of people ask me this question like, well, if I start testosterone, am I going to have to be on it forever? I'm like, well, why not replenish and feel like you did when you were in your 20s? So when I talk to my patients, it's not just about hormone levels. A lot of times I'm looking at, lifestyle, management, but I'm also looking at their free testosterone, their bioavailable testosterone, their sex hormone binding globulin, their FSH and LH, right? So there's the thermostat and there's the furnace. There's two ways that I look at things. And why does it expedite aging? Because they feel fatigued. They lack that motivation. They can't build muscle, right? And I think the key to longevity is resistance training. It's the ability to continue to build muscle.
In the world of anti-aging, there are many products and approaches that claim to be the pot of gold to help you look and feel young forever. To help us better understand the world of anti-aging and regenerative wellness is today's guest, Mary Ann Coffey. Mary is the founder and clinical pharmacist at Boutique Wellness in Winston-Salem, North Carolina. She holds double board certifications in clinical nutrition and from the American Academy of Anti-Aging and Regenerative Medicine. She is also a member of the American Society of Consultant Pharmacists and board member of the North Carolina Integrative Medical Society. I am Dr. Andrew Wong, co-founder of Capital Integrative Health. This is a podcast dedicated to transforming the consciousness around what it means to be healthy and understanding the root causes of both disease and wellness. Don't miss this enlightening conversation about the approaches Mary takes with her clients to support the body in regenerative medicine and to promote a healthy body at all stages of life.
Thank you so much, Mary, for coming on today, and great to see you again.
Great to be here. Thank you for having me.
For some background, so you're both a clinical pharmacist and nutritionist. What motivated you to become both a pharmacist and nutritionist?
Well, actually, I was using pharmacy as pre-med and just decided after graduating just to stay and keep pharmacy for a while. And after practicing for pharmacy for about 15 years, I did long-term care, some retail. It was really in the long-term care sector where I realized that I didn't want to do this anymore. It was after filling 22 scripts for one patient, and I said, you know what, there's something different here. So I went back to school and got my certification in clinical nutrition and also got my fellowship from A4M, which is the American Academy of Anti-Aging Regenerative Medicine.
Yes, that's
And
amazing.
that's when everything just took off. It's just been a domino effect since then. Opened my practice back in 2018. Started with just clinical nutrition and then morphed into hormones and now doing regenerative medicine and now aesthetics. So we're growing and I'm happy to see and happy to be here.
That's so awesome. So you've really started with, like you said, nutrition, but aesthetics, regenerative medicine, anti-aging medicine. It
Yes.
sounds like you're doing well, and we can talk about this at the end too, but your clinic is in North Carolina, correct?
Yes. Next to Wake Forest, Winston-Salem, North Carolina.
Okay, all right, go Demon Deacons, yeah.
Yeah, that's right.
Let,
That's right.
let's talk about anti-aging for a second in general for the listener. So what is anti-aging medicine? What kind of symptoms does anti-aging address? How can that help people?
Sure. So a lot of times people come to me for hormones to balance them, low libido, fatigue, no low, just flatliners. And a lot of times it happens after having some virus, whatever it is. It could be that, or it could just be something that they've experienced for the past 8 years and just thought it was normal until they realize, you know what, my partner deserves more. How do I get my libido back? So I would say it starts with, balancing hormones, but then if you do that and you don't address the adrenals, it's pointless, right? So I do address the adrenals, the thyroid, the pancreas. I look at the whole body, and as well as assessing hormones. Now, when I look at aging, what I think about are inflammation, right? I think about inflammatory cells. What we call them are actually zombie cells or senescent cells, and that is something that we accumulate over time. And the key to that is removing them, right? And how? The best way is fasting. I talk to all my patients about fasting over 24 hours, but I also talk about different supplements like resveratrol, quercetin, fisetin, and how to dose that. And then I do some biologics, afterwards to help continue that removal and help with that restoring and regenerative process.
So the zombie cells, I think that's just a
Mhm.
fascinating term. I
Yeah.
don't know who coined the senescent, zombie cells. Is the body always trying to get rid of them in general, or without fasting? Like if we don't fast, will the body still get rid of the zombie cells?
No, they won't. They
Okay,
won't actually. If we don't actively try to remove them, they multiply, or they stay dormant, or they just stay there. And so the key is to promote that, excretion or removal of the zombie cells, and that's through a combination of different things, not just fasting. It's lifestyle, it's exercise, it's increasing, as you know, apoptosis, the ability to remove those cells, but also, a series of certain supplements, green tea extract, how do we look at the cell? And this is something that my medical director taught me through years. And when I look at him, and most people think he's in his early 50s, he's hitting 70. And
wow,
that's what shocked me. It's like, he looked and I was like, well, what did you do? And it's a lifelong process of really, exercise, diet, lifestyle, and how do we slow it down? So now I'm looking at, glutathione processes, mitochondrial processes, it's all combined. So it's not just about, fasting. No, it's
right.
not, but it's a combination of that.
Would AMK help? AMK activators like berberine and things like that.
Oh yeah, of course. So I actually like, I do a lot of semaglutide in the practice, or Ozempic.
Mm-hmm.
So a lot of people also come to me for weight loss. So I do a 3-month weight loss program when I balance their hormones. Like, well, a lot of times it's weight loss. I have such difficulty losing that weight. So I do a GLP-1 agonist, which helps decrease gastric emptying, but it also regulates the blood sugar and decreases insulin resistance. So that's, I think it's great for longevity, being on a GLP-1. It's great for fertility too, and it's
Hmm.
FDA approved. So people know it. They're doing great advertising on TV, on Ozempic, so, we do that and people look for it, and it works,
Yeah.
but it doesn't work for everybody. Like for those that have SIBO or gastric issues, I don't give it to them. Or even those that have history of depression, that is contraindicated.
Ah, okay.
Semaglutide. Yeah, and
Got
people
it.
don't realize that. They're like, "Oh, it's okay." I'm like, "No, not really," because it does tend to make them a little bit more flatlined
More
over.
flat. Okay, got it. That's good. That's good to know. And just going back to hormones, since I know that's a big part of your practice, what is it about hormone imbalances, let's say, whether it's deficiency or just frank imbalances that lead to accelerated aging? And how do you typically use hormones to balance that out? And I know it's a broad question, but how are hormones related to aging?
Sure. So it's like a car, if we're lacking in, we need to change the oil, or something's, off, why not fill it? So a lot of people ask me this question like, well, if I start testosterone, am I going to have to be on it forever? I'm like, well, why not replenish and feel like you did when you were in your 20s? So when I talk to my patients, it's not just about hormone levels. A lot of times I'm looking at, lifestyle, management, but I'm also looking at their free testosterone, their bioavailable testosterone, their sex hormone binding globulin, their FSH and LH, right? So there's the thermostat and there's the furnace. There's two ways that I look at things. And why does it expedite aging? Because they feel fatigued. They lack that motivation. They can't build muscle, right? And I think the key to longevity is resistance training. It's the ability to continue to build muscle, right? And keep that waist circumference, So
Yeah.
when you balance the hormones, and not everyone needs that. You can do it with herbs, you can do it with lifestyle. It depends on how their environment has been, how toxic maybe, or that, or thereof, or lack thereof, toxicities are present in the body. But I find that just doing basic testosterone, especially I'm talking about a male patient, and an estrogen blocker, you can do that naturally, but I find that giving an aromatase inhibitor is a little bit
Yeah.
more effective.
Yeah.
And then
Mhm.
something to help stimulate the brain, because 93% of the time, if you've suffered a concussion or any type of head trauma, you have secondary hypogonadism. So what is that causing? Your pituitary is not telling your luteinizing hormone to tell your testes to make testosterone, right? So, you need to stimulate that, but we can't just give you testosterone, because what
Mm.
happens is your testes will shrink, right? No one wants that. Like,
Right.
oh, it's
Right.
okay, So that's why we always want to work on both angles. stimulating and continuing that production endogenously through that LH production, right? There's different products we can give, like clomiphene, HCG, kisspeptin, gonadorelin, depends. And it's a symphony, there's a little dance that we play here as well, because not everyone responds the same way. So I put people usually on like a retainer, and it continues, and I follow them every 7 weeks and just really just help them get to their desired state. And a lot of times they start feeling better. I hope that answers your question.
Yeah, it does. That I don't know if you know this podcast, High Intensity Health by Mike Mutzel. He talks a lot about better living through chemistry, and
Okay.
has a nutritional background too, I think. And he talks about kind of anti-aging in a way through diet and lifestyle. But I think adding some of the meds or different things can be very helpful. Herbs, like you said, supporting like all angles. Curious about your experience with peptides. I know you've kind of gotten to the peptide space,
Yes.
and how that helps anti-aging. So, first of all, what are peptides, just for the listener, and then what are some of the benefits that you can see with peptides for our health and wellness?
Sure. Well, I think peptides are definitely gaining more and more popularity, right? And the key is that we send out the right information out there so it's used appropriately. So peptides are small chain amino acids that are naturally occurring in the body. For insulin is a peptide, right? Humalog, Lantus, Levemir, they're all peptides. They're longer chain, I think 54 amino acid chains. We have the shorter ones, which are like BPC, TB4, TA1. Those are, I'm careful about saying those because they're not FDA approved, and I can't make medical claims, right? So we're very careful about that. However, what I have seen, and there are studies that support this, is that they help with gut issues, like common ones that we use that you can also find over the counter is called BPC, body protection compound. They're available in capsule, sublingual, and injectable form. I find that the injectable form works the best. However, the intranasal, there's also intranasal, helps with neuroinflammation. So a lot of times you have patients coming in with what? Anxiety, depression. So not only does it help with anxiety and depression by lessening that neuroinflammation, a lot of times their brain is just inflamed. But why is it inflamed? So you always think toxins, for me anyway, right? So restore the gut. So peptides just help, but they're not cure all. You need to follow it with nutrition, diet, and lifestyle. If you don't have that, it's pointless doing any peptides and balancing hormones. So to answer your question, they're naturally occurring in the body, and they just help heal and regenerate the body. They're usually given in small doses. You can give it in different doses, from capsules to injectables to nasal spray, and then you would administer it. Usually sometimes it takes 3 months, sometimes it takes 2 days. But what I found with like common peptides that I've recommended is that it helps with tissue repair. It helps with inflammation. So before I do any weight loss program, I got to look at their homocysteine, their CRP. What's inflamed? And if they're inflamed, it's pointless putting them on a weight loss program because they're not going to do well. So that's why I find that doing a low inflammatory diet with intermittent fasting, or a ketogenic diet with intermittent fasting, with a combination of supplements, and then add the anti-inflammatory peptides that just specific target, but they're pleiotropic, meaning there's a lot of different mechanisms. So it may be causing anti-inflammation, but it's also repairing the gut. It's also helping with ligament repair, like a lot of shoulder issues or knee issues, what I'm dealing with. You can inject it even in that area too. The closer to the site of action, of course, the better it is. So as I mentioned, I'm sorry I'm going all over. It's hard to
Oh,
just
that's
do
great.
a
That's great.
20-minute talk
Mhm.
on peptides, but that's what I'm seeing, and that's how I use them. I use them first as anti-inflammation, and then I use it as a weight loss program. So I do a lot of growth hormone precursors along with the appetite suppressant, or not the appetite suppressant, but we call it GLP-1 agonist.
GLP-1, yeah,
Yeah,
agonist.
semaglutide works great when given in conjunction to a growth hormone precursor. So I measure IGF-1 on all my patients. I like those numbers between 250 and 270. Kids, like teenagers, have optimal IGF-1 normally, right? Although I'm seeing
Hmm.
younger and younger having lower IGF-1. And what is that? That's your insulin growth factor. That measures your growth hormone. It's your rate of recovery. When that's optimized, you're finding that you're recovering faster, you're sleeping better. You can go, like, that's the teenagers that go out, drink all night, right? Sleep 2 hours, the next day they're fine, right? They have like they react like nothing. Whereas for us in our early 40s, we're tired all the time. So that's where I optimize their growth hormone as well through precursors.
So I have a lot of questions now from that comment. We're
Sure.
gonna go down different rabbit holes now. When you have someone on bioidentical hormone replacement therapy, are you always considering a growth hormone agonist as well in those situations, or when do you decide to do growth hormone
Oh, that's a good question.
agonist?
No, we're careful about that. In some states, it's illegal. In some states, it is approved, and it's very expensive to do a growth hormone agonist, for
But I
sure.
thought I thought you
Talking about like
mentioned.
genotropin and nototropin, is that what you're referring to?
I'm not sure. I just thought you had mentioned about like you have someone on a GLP-1 agonist, and
Yes.
then you're going to give them something else to
Oh, to
boost
help a precursor. Yeah.
a
So
precursor. Sorry, a precursor
yeah,
for GH. Yeah,
yeah, for GH. So when do I start it?
yeah.
I would start it as long as there's no inflammation. So I usually do an anti-inflammatory if they have no issues with that and they just want to lose weight. Or sometimes after being on a GLP-1 agonist like semaglutide or liraglutide, they plateau and they stop losing weight. And that's when I add it. I'm like, okay, let's add this adjunct to it. But you always want to separate it from food by 30 minutes, and exercise, post-exercise is when it works best. It's great for
Post
inflammation
exercise.
too.
Oh,
Mhm.
nice. Yeah,
Yeah.
that's so great.
CJC is what I use. CJC IPM 22 is the unit. They use about 5 units. Yeah, I'm
We'll
careful
have to
about
talk
that.
more
Yeah, we'll
offline on
talk a
that.
little
That's
more
a
about protocols. Yeah.
specifics. Awesome. Thank you. So, and I guess for the peptides too, just for listeners, are there any known sort of like other biological effects that would be considered side effects or those type of things for these? What's the
Well, I had
safety?
mentioned before, there are certain things that I wouldn't use, like there's MOD-SC that help boost the mitochondria, but you always want to measure homocysteine, check folate levels. So there's a lot of different things, and that's why we do education with providers. In fact, what we do is I have this educational course coming up in August in Sonoma, California. My partner, Dr. Joe Cleaver, and I are putting this together, and our aim is to bring experts together and educate on protocols, proper dosing, not just the science, not just the chemistry about it behind it, but the science, how it works, why it works, and what has worked. And then we bring our case studies with us, our difficult case studies, and people can bring them with them. And then we also have an app. So the proper use is really, it's education with our providers for sure.
Thank you. For the peptides, would you say that people could be on them long term? Is there some short course that they're on, or how does that work?
My favorite patient is the one that knows their body the best and knows what does what. So some people would say, you know what, I think I need to take a break on my BPC. I want to start on, and that's when their gut is great. Like they have
Hmm.
normal bowel movements every day. They're sleeping great. They can tolerate any food and excrete it really quickly. That's when you know they don't need it anymore, and they take a break
Yeah.
from. Does that make sense? So that's how you
It all
start.
comes back to the gut. Yeah, it all comes back to the
Yes,
gut. It sounds like, yeah,
microbiome. It all does, every
microbiome.
single thing.
Hmm.
Yeah.
Right, gut lining, microbiome, motility, absorption. And you said there's different ways to take peptides. Let's pivot a bit towards aging skin and wrinkles, because I know that everyone at the end of the day is into healthy skin.
Sure.
Are there any topicals? Now, this is a more broad question, but not necessarily for peptides. It could be, but what do you kind of recommend to address aging skin, or I guess to optimize healthy skin is probably a better way to say it.
Well, there are a couple of things. Obviously, you want to make sure you're taking good multivitamin, good vitamin A, if you're prone to acne. I like fish oil, a good quality fish oil, at least 4 grams a day. It's also great for inflammation too, especially if you're an athlete. But I find if you're really interested to get a little bit more elegant, is a peptide called GHK copper, and or GHK, right? And that is actually it's very cancer protective for anyone that has cancer, but it also increases collagen and elasticity in the skin. So does CJC. So those are some certain secret peptides that I like, and I've noticed a difference in myself. Just using I just ordered some, and it's great for scars too. So you can microneedle, add a little bit on the scars, and you'll find that it actually lessens the appearance of your scar. Just doing a little
Nice.
bit of
What about just collagen itself? Would you just
collagen,
also
of
recommend
course. Oh
collagen?
yeah, of course.
All
Collagen
that.
is great. Yeah. And then red light therapy,
Mm-hmm.
we do a lot of
Mm-hmm.
PDO threads at the clinic, but it's really, it's inside out. If your skin is looking the way it is, then it is also. And I usually do a skin elasticity test just under the eyes or on the hand. A lot of times it's hydration, just drink plenty of water. It's how you're excreting it, right? Our
We're,
skin is.
we're we're seeing a lot of people actually right now in our clinic with hypermobile EDS, with the
Mhm.
connective tissue Ehlers-Danlos syndrome. With that
Yeah.
genetics, for connective tissue, is there anything in the anti-aging world that could be helpful for promoting like healthier connective tissue if someone has a genetic issue like that?
Yeah, I'll have to do some research. I know that there is. Um, I mean, there are some peptides like it's not FDA approved here though. It's like cerebrolysin, but there is a integrative peptides that you can get cerebropep. That's more for
Okay.
nerves. But I would think that biologics. I would be careful with that. But I would even think even just regenerating that with decellularized growth factors is what we call that. It's where they remove the DNA and they add just the growth factors. So I would think something like that.
Okay, yeah, more research. That's another area for sure.
Yeah.
So you said that body protective compound BPC is one of your favorites, one to use the most commonly, you would say, for
Yes,
peptides.
pretty much everyone.
Um, I know about TA1 as well. Can you talk a little bit about that and how that can impact the immune
It's
system?
not FDA approved in this country, so
Okay.
it's one of those ones that FDA really did try to remove it from all compounding pharmacies, so it's
Mm,
very
mm,
difficult to get. But it
mm.
is FDA approved. I think it's called Zadaxin, and it's great for viruses, and it's great for boosting, modulating the immune system. That and I also like TB4, thymosin beta 4. So if I'm going to use
Yeah.
any anti-inflammatory, I usually use those three would be BPC, TB4, and KPV. KPV is a very potent anti-inflammatory as well. And I find that doing those three combinations, TA1 I'm careful about because FDA really doesn't like you and they've shut down a lot of all these
Oh,
compound
wow.
pharmacies because of claims. So we can't make any that says it
Right.
does this,
Right.
um, so it's unfortunate because it's a great peptide, and I use it for a lot of my autoimmune disorders to help modulate, right, stimulate other parts of the immune system to help them get
Mm-hmm.
them out of that innate immune system and get them more into the adaptive, or just to balance it, right, just a
Yeah.
stimulator. So it's a great immune modulator for sure.
Right, right. And certainly we also see a lot of people with chronic infections. They have no low natural killer cell counts.
Yeah.
With things like TB4 and other
Mhm.
things help with, in theory, help with the immune system that way with like boosting that innate immune system and natural killer cells.
Adaptive, I would say more not to remove you from the
Right.
innate. You're not in that hyperactive mode for sure.
Okay.
Yeah, which is
Okay.
where you are when you have autoimmune, right? Your body's attacking itself because you
Right.
can't tell the difference anymore. Everything reacts, right? You have start to develop these food allergies you never used to have. So I mean, I think my favorite's low dose naltrexone, but I'm finding people are reacting to low dose naltrexone. Like, I don't like it. I can't. I'm like, well, then we start lower. So I'm
Yeah.
even
Yeah.
starting at zero point 0.5 milligrams,
Ultra low. Yeah. Ultra
really
low. Right.
low and stay low for a while until they, don't feel a response and then go back up again and go to like
Got
one.
it. And then going back to the supplements and meds, what other things do you recommend that are kind of your go-to for use for anti-aging, I think,
For
beyond
anti-aging
peptides? Yeah,
specifically
just in general. Yeah.
or in general. For hormones, obviously I do magnesium, zinc. For blood glucose control, I like chromium and vanadium and CoQ10 because you need 8 molecules of chromium to get that insulin inserted, right? So there's a couple of products I like from Metabolic Code. Reg4 is great. But when it comes to like anti-aging, I put them on a protocol. So if they want to do like a stem cell or I can't say stem cells, but decellularized growth factors infusion, I usually get their bodies prepped. So there's that 5-day fasting mimicking diet they can do
Hmm.
from Alnutra, Prolon.
Hmm.
It's all the
Hmm.
food for 5 days. In fact, I probably need to do that because I've been cheating these past few days, eating
Time for
whatever.
a Prolon.
It's a
Yeah.
great
Yeah.
way to just detox and
Yeah.
use that,
Yeah.
that weight.
That's awesome.
But then I do like, Ficitin. So you can do that just for 5 days. You can do quercetin, about 500 milligrams twice a day, and resveratrol. Those are some great products. And there's a product, I think it's called Zombie Dust 1212. It has all of it in there. Ficitin, resveratrol. Oh, and yeah, I think those are the only products in there. And I can send you those links. I don't have
Sure,
to.
that'd be great. Zombie dust to kill off the zombie cells. Is that why it's called?
Yeah, Zombie
Yeah,
Dust to kill the
love
zombie
that.
cells.
Love that. It's good, not just for Halloween, right? For
No,
all
I
year
know,
round.
I know. It's something that people like, they love the name. And yeah, I mean, that's really what I do for longevity. It's about balancing hormones, it's lifestyle. There's other peptides like epitalin, there's DSIP, it's really about improving that deep sleep.
Yeah.
I used to like the Aura Ring until they start, tracking you.
Oh, do they?
All
Oh, I
these
don't
little,
know. I have
you'd
one,
have like
so I'll
everybody
have to
had these
check it
little
out. Yeah.
Aura rings, and I had a friend that just took it off and stopped wearing it because he didn't want to sign the waiver to be tracked and track all the information.
Yeah, yeah.
It's one of those things.
Double-edged sword. Yeah, double-edged
But
sword.
it's a great way to manage or to measure your deep sleep, and that's really key. If you're not sleeping well and you're not going to the bathroom every day, that's number one,
Yeah,
right?
you need the deep
One.
sleep to detox. Yeah, for
Yes,
sure.
yes, sir. Hmm.
What are your thoughts about increasing deep sleep? How do you increase deep sleep? What have you found to be helpful?
There's a couple of products I like Hinokial. There's one from Deep Blue Sleep that I've used. However, it does cause some weird dreams. I like DSIP, Delta Sleep Inducing Peptide. So you can do, 20 to 30 units, 3, 4 times a week, plus epitalin also helps with sleep, and it helps increase those telomeres. So they say,
Mm, nice.
I would do a test first, like True Diagnostics is a great test that can measure epigenetically what's expressed, right? And it can even give you your age based on your immune system. You're only as old as your immune system, but I always thought, you're always as old as your blood vessels too. So I would always do a baseline first, then start this program, and then do another one in 6 months and see how it's changed.
Yeah, I love that test because it really kind of tells us that it's not just about the amount of methylation, but where we're methylating and demethylating in the body. That true diagnostics test, it's really
Yes.
about the quality
Mhm.
of the methylation,
Right.
which is really nice.
Mhm.
And then let's go into nutrition a little bit. Let's touch on that since you're also a certified clinical nutritionist. What kind of, I mean, this could be a whole nother talk, but what kind of general food patterns or, healthy kind of food patterns would you recommend for someone that really wants to maximize longevity and health span and all that?
Food wise, I would say the Mediterranean diet.
Yeah. Hmm.
Yeah, I would say Mediterranean. I usually do a metabolic code diet, 1800 calorie or 1500 calorie for women. And then that in combination with intermittent fasting. Avoid inflammatory foods like gluten, dairy, soy, nuts. Those are eggs, those are some inflammatory foods first, for a few weeks while we're doing this weight loss program. And then you can slowly introduce it. But
Do you feel like eggs
easy,
is a inflammatory
eggs is
food?
inflammatory too.
Can be.
Yeah, it can be.
That's too bad. That's too bad.
I know. Especially my daughter's big into weightlifting. She hates eggs, but she started eating them because she knows she needs the protein. She
Mm-hmm.
forces herself to eat it, but it is inflammatory, and even whey protein, like that. What do we do? But I think, just having a balanced diet and improving that ability to convert to a water soluble. So making sure you're taking a good amount of magnesium, about 7.5 milligrams to 10 milligrams per kilogram is what I recommend. 10 milligrams per kilogram for those that are heavily working out, 7.5 milligrams per kilogram per day. Okay, so that's going to help facilitate that excretion. So regardless, you're eating well, but you're not oxidized, right? You're not going through oxidative stress. So that's really,
Mm-hmm.
really key. And then beets, spinach, arugula, optimizing your nitric oxide. As you know, you talked to Beth Shirley, who's my
Yeah,
mentor too. I love her.
Beth is
And
great.
it's
Yeah,
all about nitric oxide, right? So how do
yeah.
we optimize that through her supplements, but also a good quality diet that supports that nitric oxide support.
Mhm. A lot of
So
leafy greens.
that's really key. Yeah.
Let's talk about sauna. I'm kind of getting into that too. We know that sauna can help with both nitric oxide, but also there are some studies from Finland, I believe, that show that sauna can promote longevity.
Mhm.
Do you use sauna in your practice, or either
I
personally or
do. I
professionally?
actually have one here at the house, and I do it
Okay.
very
Okay.
often because I haven't done a metal testing on myself. I've been meaning to. I had one and ended up not doing it. Right. I'm going to do that soon. We're worst advocates, right? You know,
Everyone is high in metals, by the way. Yeah, that's
yeah, I
when
think
you test.
so. So,
Pretty much, yeah, yeah,
so it does help remove that
yeah.
mercury for sure. That's the only way that I know you can. So, in terms of it increasing nitric oxide, that is interesting. I haven't read that study from Finland. So if you can
I
share.
think it just increases circulation, so you're kind of
Okay.
through the heat,
Yeah.
just through the heat, and I think with the then the near infrared light, is more involved with the mitochondrial biogenesis and things like that. I
Right.
think similar to like especially if you have sauna plus infrared light,
Yeah.
that would be a good combo, potentially. But
Help
that's
promote
good. So
healing
yeah,
for
that can be
sure. Mhm.
helpful. And where are you on exercise, or like we like to say here, movement? How important is that for anti-aging? You talked about, I think before, kind of addressing sarcopenia and building muscle mass, and that's a big predictor of longevity and health span. So what do you generally recommend for exercise for people?
Sure. I would recommend at least 3 to 4 days a week of resistance training, plus about 2 to 3 days a week of cardio. It doesn't have to be a whole hour. Hit training is suffice, but really that resistance training, doing weights is really key. And if you're not building muscle, I have a lot of patients that are elite athletes that do or ex-military,
Yeah.
so they're going to the gym 5, 6 days a week and they're just not performing. So I help them with in that regard with some peptides, right, that help
Hmm.
increase that growth of muscle tissue. But they're also, can't perform because they're in pain, right? They
Mm.
can't do what they used to do. So that's why that's another added effect to that. But I would say for sure resistance training at least 3 days a week. You can even just do that band, get it if you're at home. You don't necessarily have to have, personal trainer or anything, but I would definitely recommend some good weightlifting and then grip strength. Check your grip strength. That's really number one too. People
Hmm.
forget that's the fundamentals of anti-aging is how strong can you open up a jar of jelly or not jelly. You don't want to have jelly. But what are we opening these days? But yeah,
Let's see. Open up some BPC. Maybe there's like a really tight BPC jar that you could open. Yeah. Well, what
I
I
did
always
have
think
jelly
about is
this
this.
morning, so I did cheat this morning. So
Hey, at least have a little fruit in it. Maybe a little
yeah,
fisetin, right? I think strawberries are high in
yeah.
fisetin. Um, you could do a grip strength with like a thumb wrestling, like
Oh
even
yeah, yeah.
thumb wrestling with your
You need
kids
some
or something.
more?
Thumb war, yes, yes. 1, 2, 3, 4.
Yeah,
Yeah,
that's
there you
fun.
go. Yeah, so fun ways to promote grip strength. What do you think about weights? Like, does it have to be like free weights, or can it be like body weights for people? Can you build up muscle just through body weights
Oh, of
alone? Like,
course.
yeah,
Yeah, with your own body resistance training,
yeah,
even just
with your own
planking.
body resistance,
Yeah, for
right?
sure. Yeah, I think that's the best way. I think yoga is really helpful, which is
Mm-hmm.
pretty much your own body's weight, right? You help sustain, but you're not going to build so much muscle, but it's going to help with that flexibility. I think it's a combination of doing
Yeah.
that because you also want to push yourself a little bit more at the gym. I think for me anyway, that's just how I am. You always
I
want
was trying to get the yoga comment in here because we have some yogis in our practice, so I'm kind of curious about how they're going to build muscle. And maybe there's a new combination sport like yoga weight training or something. We should
yeah.
create that. It's like,
That's like jujitsu, which is forced yoga, which I tried, but it wasn't for me. So yeah.
okay, okay, nice, nice.
Yeah.
So let's talk about some more fun questions. I think this is a great overview of anti-aging, and thank you so much for coming on, Mary. You're very expert in this area, so definitely have to talk more offline on this too. Let's talk about your morning routine, if you don't mind. Morning routines are really, really helpful for kind of establishing a daily, repetitive in a way pattern of healthy habits that will promote longevity and promote health. So if you don't
Mhm.
mind sharing your Mary's morning routine here with
Sure, I'm
us.
an early riser. So I actually, I'm a boxer, so I box 3 days a week, Monday, Wednesday, Friday, and that starts from 6 to 7. I usually sleep between 9 and 10, so I sleep pretty
Nice.
early. I have a
Uh-huh.
routine, like my dog knows, like, oh, it's time for bed, they feel it.
Yeah.
So that's really the key is honoring that time for sleep. But even before that, when I wake up in the morning, I just learned, I'm like, you know what, we really need to program our minds what we want, right? Yeah, you can do all these things, you can deep sleep, but telling your body, telling your mind what it is you want to feel when you wake up, or how you want to, like, how you, just what you want to do before you go to sleep is one of the most powerful things we can do. And I just tapped into that just recently, and I'm going to start doing that even more. Then you wake up, you feel great, right? You want to tell yourself how you want to feel when you wake up and what time you want to wake up. Try it, and
I
you'll be
will. I will
surprised.
definitely try that. Thank
Instead
you
of
for
like
that
setting
advice.
your alarm, tell yourself, I'm going to wake up at 5:55 or at 4:45, whatever time it is. But I firmly believe in allowing yourself that time to wake up, to have that coffee, to be into yourself, right? And to meditate,
Yeah.
and or prayer or
Yeah.
surrounding myself right now. I believe in God, and I've been praying, and I've been doing that, and that's been helping me, either reading scripture or surrounding myself around that.
I think the mindset and the affirmations really framing that day, like you said, even the night before, that's so powerful. It's so
Yes.
healing.
Yes.
Definitely going to try that. Thank you for that
You're welcome.
advice here. And what do you do every day to cultivate joy? It sounds like there's probably a lot of options there. That's another kind of general.
It's sometimes you push yourself to do things that will bring you joy until that joy happens. Does that make sense? Because it's easy to sulk in misery. It's easy to be alone, and it's easy to think about and let all these negative thoughts into your mind. But what you do is you allow yourself to do something that will bring you joy. Like I started golf again, went and bought golf clubs. I started go to the range, even if I'm just by myself playing. That's okay. But it brought me joy. And you do those things until you do it, or giving, or service, talking to someone, looking at them, and connecting. That for me brings me joy, is that
Yeah.
connection with
Yeah.
people, because we're all connected. We don't
Right.
live on this planet alone, and we all need that,
Yeah.
because who knows where we're going to be, but what we do have is humanity, and no one can ever take that away. So that's
We're,
how I find my joy, is through people.
Yeah, I think the connection is huge, and it's really something that, as you know, we kind of evolved or were created in tribes, like villages in a way, and sometimes that social connection is really life-giving. It's just by connecting to others and being of service, but also kind of just connecting to people, is so healthy. It's so
Yeah,
healthy, and we see that even I think even in research on longevity and health span, is that the people that are more connected, they live longer, they're happier, they have more joy, all these things. So
yeah,
really the human connection is in a way one of the ultimate anti-aging
yeah.
strategies, I would say, is to stay connected to your tribe.
Well
So
said.
thank you so much, Mary. I know you have a few sites where people can kind of access your wisdom, work with you. So how can listeners learn more about you and work with you?
Gee, I guess they can go on my website. It's my practice name is Boutique Wellness. So the website is Boutique Wellness and then NC North Carolina.com. So it's Boutique Wellness NC.com.
Are
Uh,
you doing telehealth, or do they have to be a resident of
no, I am doing
Integrative?
telehealth as long as it's not
Okay.
controlled substances, that I can do a ton of
Okay.
nutrition.
Yeah.
And I also work at a practice TRTMD, so we do see patients there. It's in Maryland.
Okay.
And they're probably the number one prescriber and provider of hormones in Maryland,
Oh, I
actually.
don't think I know about that. Where is that
TRT,
located?
they're in Severna Park.
Okay.
So I do
Okay.
a lot of their consulting as well.
Cool.
I
All right. I have
love,
to check
and
it out.
great, great, great patients and great staff. It's really great family there.
Awesome.
Along with my practice in Winston, where we do a lot of IV therapy. I just purchased an ozone device, so we do ozone therapy too, and
Nice.
hormones. I do a lot of just hormone packages. But I am happy to see you, as long as you just see me once a year. I'm happy to do telemedicine anywhere in the country. And then
Good.
soon we're going to be providing it overseas as well.
That's
That's the
awesome.
goal.
Super exciting.
Thank you.
Mary, great to connect with you again here, and we'll chat
Um,
soon. Thank you so
it was a
much.
pleasure. Thank you.
Thank you for taking the time to listen to us today. If you enjoyed this conversation, please take a moment to leave us a review. It helps our podcast to reach more listeners. Don't forget to subscribe so you don't miss our next episodes and conversations. And thank you so much again for being with us.